Yay, updates. So tomorrow it will be 2 weeks since I had my fetal surgery. Um, I am still staying at the family house down the street from UCSF right now, and I will be here until this Thursday. Well, this Thursday I have a bunch of final appointments, another ultrasound, just a whole slew of things to just give the final okay that we can go, and then I plan on going home on Friday, which is awesome. I had a bunch of appointments this past Friday, and all of those went really well. The baby has plenty of fluid around her, which is, as I've explained before, really important. I'm not like contracting, more than like normal Braxton Hicks type stuff, so that's good. And yeah, just everything looks great. It was kind of cool to see her ultrasound on Friday and see her spine and to not see that big sac on it. So that was cool. It's like, it happened, but it was just kind of cool to see it on the ultrasound. Let's see. The only kind of complication that has arisen, I guess if you call it that, would be a couple days before my appointments, I started itching, like really bad, like especially the palms of my hands and the bottoms of my feet, and then like random sections of my body would like itch just uncontrollably. Like I was getting sore from just the amount, like parts of my body were getting sore from me itching them. And I knew that this was a sign because my mom had cholestasis of the liver when she was pregnant. It's a pregnancy problem. Usually, and my mom itched with all 3 of her pregnancies, and each one it got worse, like significantly worse, like, and they told her there was just nothing they could do for her, and even though they knew what it was, they knew it was the liver. She did deliver early with all of 3 of her pregnancies, 36 weeks, 34 weeks, and 31 weeks with the twins. And so anyway, because I knew that about my mom, I kind of knew that the itching might be a sign of that. So when the doctors just kind of called me to check in that day, I was like, hey, I'm itching really bad, and I'm wondering if, I didn't know if it was maybe a side effect of one of my medications or what, and they said, well, where are you itching? And when I specifically said the palms of my hands and the bottoms of my feet specifically, they wwere like, can we put you on hold for a sec? And I'm like, oh, great. And sure enough, they were like, we need you to come in. Just, not like majorly rushing, but pretty soon. And we're just gonna have to get you some blood work, get some blood work done to check your liver, because, it's the palms of the hands and feet thing are a definite sign of cholestasis. So anyway, I went in, we did the blood work, did everything, and there was one test that they could do immediately, and that one came back like kind of high, but not like, not like outrageously high or anything. And then there was another test that was going to take another day or so. So by the time on Friday that I got to my appointments, that test had come through, and that one had come back significantly higher, which kind of cemented, the doctor said that yes, they're going to go forward with a diagnosis of cholestasis. Luckily now there's a medication you can take to kind of help with that, helps with the itching, so I've been taking that, and I've noticed a definite decrease in the itching, which has been welcome. And then the only other complication is that often cholestasis can increase your chance of having a stillbirth, which is why often patients who have it are, their babies are taken by C-section several weeks early, and then, and watched very carefully that if the levels are just getting higher and higher, then they might require you to deliver, because they're afraid of stillbirth happening. Well, in Cedar's case, she's already coming early, so they're not going to really worry about that, except just making sure that they're testing me and watching my levels to make sure it's not getting like out of control with my liver. And so anyway, so we'll see. Hopefully just taking the meds will keep everything under control, and we can continue to let her just stay in there as long as possible until 37 weeks, which is when, because of the spina bifida, because of the fetal surgery, actually, they're going to require that I have a C-section because I'm not allowed to go into labor for the rest of my life. So, after this. So there we go. So anyway, that was really the only complication, but I'm glad it wasn't anything worse, and it had nothing to do really, super specifically with her. Like, she still looked great, her heart looks great, everything looks good. So anyway, I'm excited to get to my appointments on Thursday because I really want to go home. Even though I still can't do a whole lot when I'm home, it'll just be nice being in my own bed and with my children. Seeing my husband and my kids is needed. So anyway, I'll let you know how things go, and then I think I'm also going to do a tour of the family house at some point, probably tomorrow. But anyway, that's the update. I've just been, again, I'm sort of on like modified bed rest. Like, I'm not required to stay in bed or anything. That would be terrible. But so me and my mom have kind of been out and about a little bit, like kind of doing some sightseeing. She just pushes me around in the wheelchair if it's far, and if it's not far, I just like push the wheelchair myself in case we need it. But we're pretty much supposed to take it with us wherever we go, just in case if I get tired or something, or there's an emergency, that they have the wheelchair for me to be pushed in. So it's not my favorite thing, but I recognize why it's needed, so I'm trying to be patient with it. But it does feel really good to walk. And update, my back is healing, I think. Every day just a little bit better. It still gets easily irritated from me sitting in really staying in any one position for too long irritates it. But I can at least, like I said before, kind of flip over now in the night easier and easier, which is allowing me to kind of change positions more. And I'm wearing my back brace, like, just for kind of sections of the day, to kind of give it that extra support. And so I'm really grateful that it's starting to feel better. Yay! So we'll see. I don't know how long it'll be before I would say it's back to normal. Probably right before I get my C-section, and then it will maybe start all over. Good times. Anyway, that's the update for kind of week 2, I guess, post-surgery, and I will update you probably after my appointments on Thursday. Yay! See ya!